Hello everyone, welcome to Resident Not Not 7. Myself, Dr. Sibi. I recently completed my MD medicine from JIPMER. I joined JIPMER in 2021 and I completed in 2024. Along with me is Dr. Govind Maniar. He is also one of my colleague, and we both were co-PGs for a long time. And Dr. Govind, let introduce yourself.
Hello everyone. My name is Dr. Govind Maniyar. I'm 2K15 batch student. I have finished my MBBS from Government Medical College Latur from Maharashtra. We finished in 2021 and we both are 2K15 batch students and we both got in first attempt of INICT and joined in July 2021 session in JIPMER as
Yeah.
medicine PG.
Yeah. So before going to that, Govind was particularly from Maharashtra. Since JIPMER is located in Pondicherry, initially he had certain difficulties about which he will explain now. How he got through the barrier of language and how he got. Now he will be able to frequently speak in Tamil also. I think so. எப்படி இருக்கீங்க?
I can speak, yeah, I can speak more
Yeah.
fluently now.
Yeah, he can speak fluently actually. He used to sit with me in a year and used to take notes, what and all words mean in Tamil and English, and now he is very fluent. Yeah, that the system itself changed him so much. So, yeah, now we will proceed with the most interesting thing. How is the resident life in JIPMER in the past and how it is currently now? Before going to that, we will see how the system works. So basically, JIPMER medicine works like in semester wise. As since every 6 months, INICET is happening. Every 6 months, around 12 medicine PGs will be joining there. So each semester, 12 PGs will be there, and the system circulates on. So total 6 batches will be there, which will be divided as 6 semesters. So once you enter, you will be in the first semester, and every 6 months you will be upgraded into second semester, third semester, fourth, fifth, and sixth respectively. So the system operates on giving responsibility. So once you enter into a once you've entered into the course and 3 to 4 months have passed and you have gained enough experience, you will be given sole responsibility of your cases. There will be no teamwork, but you will be given individual cases to you, and you will be the sole responsible. You will be solely responsible for those cases, and of course, senior residents will be there to guide us. But the thrilling and the most satisfying experience is that you will be managing your own cases like a junior consultant, like consultant level. And there obviously there will be SRs and obviously there will be professors to guide you. But you will be the primary treating resident for those cases. It won't be like DNB where you will be going and working in a private college and you have to work and you have to do scut work, but you won't get the recognition. But here you will be primarily treating the cases, and you won't believe whatever cases I have treated till now. Most of my patients are calling me till now, even after 1 year of completing my PG. All of them are calling me and asking doubts. Particularly one patient of aplastic anemia I had treated in my fifth semester, that is during my final year. He is now also calling me for advices, and now also I am following up with those patients. That is the very best thing of working in JIPMER, particularly. Do you agree, Govind?
Yeah, definitely. Definitely, that's very nice thing. Initially, it will feel overwhelming. You will get all stressed. You will not have that much experience, and like one or two patients will get sick, and you will definitely get sad. You are not used to those things. But eventually, as things like go on, you will get better. You know better things, and those treating patients on your own, you go back. You have to read. Definitely, senior residents, consultants are all there to support you, but you will be the first line, like they say, the first line of defense. So you are the first person. Uh, so yeah,
Exactly.
it's like very nice thing, but yeah, it's equally responsible also.
Yeah. So the system is divided into 6 semesters, as I already told. The first 3 semesters, you will be seeing cases which are core medicine. You won't be seeing that much of super specialty cases. In first 2 semesters, you will be seeing common cases like fever, dengue, lepto, scrub typhus, like common cases like snake
CKDs,
bite, yeah,
PMIs,
CKDs,
CLDs,
MIs, exactly,
MIs,
exactly.
CLDs, and all those
So
things.
whatever cases you used to see in state medical colleges, you will see those cases, but the real kick starts when you enter the senior semesters, particularly fourth, fifth, and sixth, where you will be exposed to n number of super specialty cases, particularly hematology, uh, nephrology,
Neurology.
neurology, and rheumatology. Particularly, we have seen many
Rheumatology.
CSLEs, and we have done. And guys, you don't know, in JIPMER medicine, you will be exposed to many procedures. That is the very, very good thing about JIPMER. Me and Govind have done many central lines, dialysis sheets, n number of intubations, n number of bone marrow biopsies, particularly renal biopsies for that matter, and even pericardiocentesis and a temporary pacemaker to a certain extent we have done. So we are very well experienced in that. We have done many procedures, and procedure changes you will get many. Not and even arterial lines also. Many people have put in our ICU. So that much exposure you
Yeah.
will get. And as I told, once you enter into the final year, you will be seeing a lot of super specialty cases because our super specialties are understaffed and under the beds ratio are very, very less. So whatever cases comes into emergency will be admitted under medicine, and have only then the super specialties will take over as they have shortage of beds. So you will be exposed to a number of cases. Particularly in hematology, we have both treated aplastic anemia, leukemia, what are even very, very complicated cases, AML,
Lymphomas,
CML,
many lymphomas.
yeah,
Yeah,
multiple
MDS,
myeloma, multiple myeloma.
myelomas.
Yeah, we have treated, and we have even we are following up with them currently. Particularly aplastic anemia, ATG is being given there, and rheumatology, particularly SLE, a number of SLEs and a number of biopsies we have given taken from them, kidney biopsy, lupus nephritis, and of course, what else I am missing? Nephrology also. Whatever case comes, medicine does the renal biopsy first, then only nephro does. So neurology also, particularly GBS, transverse myelitis, uh, many complicated cases we have seen and we have managed. Then only the patients will be shifted to the respective super specialty department. So it was very, very beneficial for us, and we have seen many complications, and we are confident enough to manage those complications, I think. Do you agree?
Yeah, yeah, yeah. As a resident, like you will do complications. Sometimes you will
Yeah,
mess up, but yeah, you will learn, you will manage them properly. At some point, you will be so confident of like managing those things.
exactly. And yeah, as I already told, senior residents will be available round the clock, and consultants will be there, and they are responsible for whatever we are doing. So no need to worry about the responsibility thing. So as I already told, the responsibilities I have told, and the semester how the system works I have told. Now we will go on to talk about the infrastructure available in JIPMER. So yeah, so apart from basic investigations like CBC, peripheral smear, RFT, LFT, we have a good pathology and biochemistry department, and we have done, as I told, many bone marrow biopsies we have done, and all these bone marrow biopsies, the report will be available within a week. Similarly for kidney biopsies also, and we have hormonal assays. You used to routinely send vitamin D and calcium assays for the CKD patients, and hormonal assays for evaluating these patients. And
All immunological
yeah,
investigations.
yeah, exactly. C3, C4,
Yeah,
and ANA, everything is done free of
ANS and
cost.
all these things. Apla
Everything we
panel you
have
will
done
have.
exactly,
Then neurology you will have NCS, EMG, and all these things
exactly.
like
All these
EEG.
things,
All these things. Yeah,
everything, everything they have, and of course, MRI is there as any tertiary care hospital, and they have a very good functional medical
PET and
oncology.
like same. There is, yeah, there like nuclear medicine is also there, so you will get all these PET
Exactly,
scan and all these things.
exactly. So all these things are available there. So you will have a better infrastructure, and you can do any kind of investigation. Some investigations may not be available, but you can outsource that. Some investigations will
Yeah,
not be available. Like for CML, you have to send BCR, ABL, PCR. You can outsource that to CMC, I
yeah.
think. Yeah, exactly. So those kind of
Maybe if sometimes we send our biopsy to Nimans also.
exactly, yeah.
Yeah, and then
All these
ANA
status epilepticus, want to rule out autoimmune encephalitis, we used to send to
encephalitis
Nimans.
panel also Nimans.
And at a concession only, at concession cost we can send exactly. and those are
Hmm.
the facilities available there. So we have finished the infrastructure also. And coming to academics, can you explain our daily routine? How we used to go to academics?
Yeah, yeah. Till maybe second or third sem, you like we didn't really get so much of time to go to the academics. But after that, yeah, we started going to academics. Our academics, like it's there from Monday to Friday. There is no academics on Saturday and Sunday. On Monday, there will be interesting case discussion. So what is like every unit wise, as Sibi told you already, we are having 6 units there. And whatever the interesting cases the residents in the particular units have seen, they present there. Like it's a really good thing. You will get to know about the rare cases and how that unit and the residents of that unit consultant thought of something else, and then it turned out to be something else. It's a really nice thing. If interesting case is not there on Monday, we will have the PG clinics. PG clinics will be taken by the mostly by the HODs or maybe by the senior consultants. So some PGs from fifth sem or sixth sem, they will take one cases and they will present in that like PG clinic session, and HODs will like guide you. It's a really nice discussion. Like it will be proper clinical discussions. They will ask you to demonstrate. They will ask you to palpate spleen, palpate liver. It start from the basic till advanced. They will ask you the different questions. Cardio also, like hearing the murmurs, what is thrill, what is murmur, and all these things you will get to know in the PG clinics. Next day comes like Tuesday. It's the day for the mortality meet,
Exactly.
which we all scared of. In the mortality meets, like whatever the patient dies, like obviously it's not possible to discuss the every case, but maybe like some 5 or 6 patients which have expired in the previous week, which will be discussed in that mortality meet. So yeah, you like if your patient appointed under you is like has expired, then you have to present this case. Like start right from the like how the patient presented to you. You have to present the history, and then what you thought, what treatment you started, what investigation you have done, at what time, what drug given. Like everything will be scrutinized. You will be scared for that. But sometimes things are not in your hand. Even if you like do everything wrong, patient may die. So yeah, that's also the good learning thing. You will like definitely find out, or the consultant sitting there guide you that you should have done this instead of this, or you should have started this drug, or you should have thought this diagnosis. So yeah, it's better for you and the other PGs. Like from the mistake of you, the others learn. So yeah, it's a good saying that you learn from the mistakes of others. So that's the one for the mortality meet. The next day comes again the most scarier day. It's model exam. So model exam is like
Yeah.
yeah, it's a real scary for the sixth time residents
Yeah.
specifically. Two residents will be presenting the cases. Like one resident will present long case and one will present short case. Long case will always be like 95% of the times it will be CNS case. Yeah, and in the model exam, that all the consultants will be sitting in front of you, and same thing like the PG clinics, you have to present the same thing, but now all consultants will be sitting. So, and it will be very, what we say, it's like serious discussion. Same, you have to start from the history, and you need to know the very basics of Tamil also while asking the history of CNS patients, particularly ones who are not from the Tamil Nadu or from the Kerala. The other state people may find some difficulty, but eventually things get better. So yeah, history examination and all these things in the model exam. One long case and one short case. If long case is from the CNS, short will be from like RS, CVS, or maybe abdomen. The next day comes the journal club. In journal club, 3 residents from the pre-semester present one recent article. It's also like it's a really helpful, or what we say, it's really important discussion. Journal club. We get to know the recent advances. We get to know the what drugs are approved recently, because all articles will be presented there are like related to medicine and maybe medicine subspecialty.
Exactly.
So yeah, so and you will be managing those patients, so it will be beneficial for you also. And the next day comes the review,
Friday.
like the
Yeah.
long review. Yeah, Friday it's for the reviews, either long review or the short review. Review means one resident from fourth and fifth sems specifically are given one topics like whatever I had like vitamin K, warfarin and vitamin K, all these things. I have presented on the warfarin. CB has presented on what it
Thrombotic
is.
microangiopathy.
Yeah, TMS. CB session was like it's really good. So he has presented on TMA, and like there are different topics given to all the residents. So they prepare their presentation and they present. It's a really nice thing. So yeah, this is how we present the academics.
Yeah. Yeah, Dr. Govind, I know you're from North India and you had certain difficulties when you joined as a first year PG. Can you elaborate on the difficulties and how you overcome that to become successful here? Yeah, please.
Yeah. Uh, Basically, I'm from Maharashtra, like North India only. So Tamil was like very foreign language to me. I didn't know a single word of Tamil. So coming to like I had this difficulty from the first day because you won't get leniency like okay you are new here, like wait for 1 month and maybe after that you start taking cases. No, no one gives you that leniency. You have to sit, you have to start taking cases from the first day of your joining. Uh, though it's in OPD, you have to sit alone, or maybe in the like emergency duty also, you need to sit alone and take the cases. Initially, I used to search for Hindi patients, but yeah, 9 out of 10 times I used to get disappointed because barely anyone speaks Hindi, and for that matter, Tamil there. Sorry, for that matter, English. So you need to know Tamil. Um, so I had one PDF, like we had one PDF in JIPMER of Tamil and English words. So I used to use that initially, and also more of those PDFs and YouTube videos, like colleagues like Sibi and your seniors, interns, nursing staffs, they help me more. Um, I used to ask them, what does this mean? What this patient is asking. I used to irritate them so much, like interns specifically. I used to ask them sit by my side, like till I finish taking case, and they used to be a translator. So yeah, it was fun. Initial, like few months maybe, yeah, initial few months. Then after that, obviously, I started Tamil. Like I started to talk in Tamil as much as needed for like the basic history taking. Not very advanced Tamil, but yeah, the basic history taking, I started talking. Mm, and again, yeah, the most important thing is when used to speak in Tamil with my colleagues like Sibi, with Sibi I could have spoken English as well, but I choose to speak in Tamil because I wanted to learn Tamil. So that was really helpful. Like that with all my Tamil batchmates, I used to speak in Tamil. So that's the most important thing. If you are coming to South India, yeah, you have to do that. And one thing I want to like tell you for the people who are confused whether we should come to South India or not. Uh, to be honest, you should not miss institute like JIPMER. To be honest, you should not miss branch like medicine in the institute like JIPMER because it's very beautiful. Medicine in JIPMER is really nice. Uh, like what Sibi told you, the amount of cases you see, the amount of investigations you do there, the kind of protocols you follow, the kind of drugs you have there, like ATGs and IVIGs and all these things. It's your decisions. Like you can convince your consultant. Then I want to give this patient IVIG. I am thinking this patient is GBS, and I want to try IVIG. Like it's a something like NMOSD, and I want to give IVIG. So it's like it's your decision, right?
Yeah, the
So you
ball
need to
is in your
convince your
court. Exactly. The ball is in
yeah
your court and it's you who have to fight for those patients. So you will be
yeah.
the primary
So
consultant. Exactly. Yeah.
so just for the language issue, I don't think you should miss should take JIPMER. But yeah, if you have other chances, other opportunities like AIMS, Delhi, and maybe PG, I think you can opt for that. But definitely, language issue is there, but it's not that severe. Everyone, like many people, many North Indians are here in every department, in super
Yeah.
specialty. in medicine, in surgery, in other department. Everyone learns, everyone talks. So yeah, it's nothing big. I should I wouldn't have skipped medicine. If I'm getting the other chance, uh, I will again go back to JIPMER
Yeah.
for
Basically,
medicine.
our batch had 12 people, and nearly 5 people are from North India only. And
Yeah,
one
five
from
people.
Gujarat, one from Uttar Pradesh, one from Delhi, and you from Maharashtra, and one again
Maharashtra,
from, yeah, Northeast. Even
Northeast, Arunachal.
exactly. And all of them learned the language, and all of them had their reasonable amount of success. And Dr. Govind, we have to address the ghost. So many people are scared of toxicity in JIPMER, particularly JIPMER medicine. Do you think the toxicity has affected us so much, or do you think this wait, this is again I will start. So, Dr. Govind, we
Yeah,
have to address the ghost in the corner. So, basically, everybody wants to know whether JIPMER is toxic, whether doing medicine there we have to sacrifice so much, whether it will be mentally exhausting or not. Can you answer those issues? We have to answer those, I think.
yeah, uh, yeah. We have suffered. Toxicity was there,
Yeah,
but to be honest, it has come down a lot now. Now things have got so much better. Right from the consultant level to your seniors level, now people are more considerate.
exactly.
In our first and second sem, we had alternate day duties. Like alternate day, we used to stay in hospital. So, like if I'm coming to hospital today 7 a.m.,
Yeah,
I will leave the hospital tomorrow maybe 6 or 7, like
yeah,
evening 6 or 7.
exactly.
And then next day morning again, I need to come at 7 a.m. in the hospital. This was the work culture was there previously in our first and second sem.
Yeah,
Both me and Sibi have done that, but now things are better.
better.
Now toxicity is so less. Whatever you have read in news and all, it was there. Obviously, it was there. Some concerns were toxic, but now, yeah, that's what I said. Everyone is getting softer. It's no more the hostile environment. It's like very favorable environment for your growth. So
Yeah,
don't fear the toxicity at all. It's not the toxicity anymore. It's just the JIPMER standard. And yeah, obviously you need to maintain. If you are coming to JIPMER with a mindset of like enjoying and all these things,
exactly.
definitely then you will be in a big trouble. You cannot say it as a toxicity, but yeah, obviously you need to work hard to cope up those JIPMER standards. That's the only thing is there, and that will be so much beneficial for your like future. Maybe now we both sit and like we are preparing for our super specialty exams. Now all we have is our experience and learning from the JIPMER. Those sufferings were in the past. So one thing I want to tell you that those sufferings are like temporary, but you gain the knowledge, you gain the experience, and that lasts with you forever. So yeah, don't fear toxicity. It's like same in every government hospital, like in JIPMER. Don't trust those news and what other people say. Now things have got better.
Exactly. Yeah, things have
Yeah,
gotten very better now for residents. And one thing I must tell, after finishing my MD and I'm currently working in some hospital, so you can feel the difference and you will be very confident. One thing, and your communication will be better, and you won't doubt yourself for that matter. Your skills will be top notch, and your knowledge will be very fine. So in order to become a good doctor, like we have become a better doctors because we have gone to that place, and that place has turned us into better human beings as well as better doctors. That's what I wanted to tell. And guys, I have made this video particularly for people who want to join MD medicine at national institutes, particularly like JIPMER aims, and who are afraid of joining that because of the language issues and the toxicity prevailing there, and who are having doubts whether if I go there I will survive or not. This video is especially for you guys, and I have invited Govind for that particular matter because he came from Maharashtra, and he survived here for 3 years and he excelled here. And if he can do, you can do also. And all the best for your future endeavors. And Thank you. Signing off. Dr. Govind, you have any few words to say?
Yeah, yeah. About medicine, it's a mother branch. Obviously, it's a really nice branch. If you have any doubts of should I take medicine or not, take it blindly. Yeah, you have to work hard. If you are willing to work hard and if you are willing to sacrifice some things, definitely medicine is the best branch you can ever be in. And second thing, JIPMER is the best institute. So don't
Exactly.
scare coming there. Like, don't fear anything. Just sit, prepare properly for your entrance exams. Yeah, people say like branch matters over the institute. Yeah, branch does matter, but institute also carries the equal importance. From where you are doing your PG also having the equal importance. Now you go out and now if we tell the people like we have done medicine from the JIPMER, so their way of looking at us
Yeah,
changes.
exactly.
They look at us with more respect. It's not just about people looking at you with respect, but the knowledge inside you, the experience inside you is also something which you will be proud of. So institute equally matters like the branch. Now we see the people now I also worked in one medical college as a SR, and now he's also working. And outside also you see, and you like within 5 10 minutes you will get bored of those people, like what these people are doing. I'm not like degrading anyone, but yeah, there will be some differences between what you practice in the central institute and what you do in other colleges and other institutes. So yeah, it's always better to get from the central institute, and how much better you will get to know after entering in central institute only. Till then, you will not know the difference. I am from the state college, he is also from the state college. So we
Exactly.
know what happens there. So yeah, all the best. Do well.
Yeah.
So
Thank you.